Hi, this is Dr. Diaz again with Momentum Chiropractic and Rehab. I'm here today with Chris. So Chris has been a patient of mine for about 3 years. With Chris, he came in initially with some pretty traumatic injuries. He had multiple disc bulges, herniations. He came in with low back pain, like, hey, can you please help me? At the beginning when I first saw him, I was like, yeah, absolutely, I can help him. And as Chris can kind of attest, as we started going along in treatment, I started to realize that it was a more complex case. With Chris, we've done triathlons together. He's an avid athlete, so he's one of the guys that you're going to tell him, hey, you need to stop running, and he's not going to stop doing it. You need to stop lifting, he's not going to stop doing it. You need to stop swimming, it's not going to happen. He lives an active lifestyle. He is an owner of a cycling studio right across the hall of my clinic. So he's used cycling as his form of health and wellness so that he can still perform the athletic, his endeavors that he wants to achieve, his health and wellness status, physique, so on and so forth, and at the same time maintain a low impact form of exercise. So Chris, tell us a little bit about your business and just how you met us in general and where we're at.
Thank you. So again, Chris from Apply Fitness Cycle. I'm here to get my weekly adjustment. So through chiropractic and then along with indoor cycling, it's actually, like Dr. Diaz said, extended my workouts. My recovery time is much faster. The good thing about indoor cycling is it's no to low impact, especially with our wheel rider bikes that actually move. They move with your body. So that's another way for us to really take care of yourself. Your ligaments can move, spine, hips, ankles, the whole nine. So for me, like Dr. Diaz said, I suffered from actually a double blowout hernia. So I had a hernia and then another hernia bust out of that one. I had that surgically removed about 2.5 years ago, rehab with the bikes and through Dr. Diaz's adjustments. I also suffer from some ligament damage and severe plantar fasciitis on my left foot. Some days it's really hard to get out of bed and walk. My weekly adjustments help with all of that. It's hard to explain what chiropractic does for you from a standpoint of just feeling right. There's no other way to explain it. So with my adjustments and feeling right, mixed with what we do at Applied Fitness Cycle with our no to low impact workouts, I've been able to extend again my workouts and shorten my recovery time a whole bunch.
So it's good. I'm glad that Chris is noting the feeling right? And this for our purposes, we want to educate our patients on what chiropractic does for you: spinal manipulation, spinal movement, segmental range of motion, right? Decreased inflammation segmentally with chiropractic manipulation, chiropractic adjustments. So there's a lot of biomechanically and what we can discuss about how it helps you. But overall, the proof is in the pudding. You're not going to return to somebody who doesn't maintain your wellness, who doesn't get you pain-free, who doesn't get you to continue the physical activity that you want to perform, right? So at this point, like I said, he's here for a weekly assessment, weekly adjustment. We're going to go ahead and adjust in the cervical spine today. We're going to adjust in the lumbar region. Like we said before, he's had a couple of surgically removed herniated discs. We still perform chiropractic manipulation. We still want to introduce and maintain spinal mobility within the lumbar spine as well. And then we're going to go ahead and adjust his foot today as well. So Jason, if you can, just set up right over here. And then Chris, let me have you scoot just a tad forward onto the chair. Lean back right here. And just like normal, relax here. I know it's your first time on chiropractic video, but don't be nervous. Relax right in here. Very good. Okay. Excellent motion. Relax right here. Very good. Let me have you lay face down right here on the table. All right. Very good. All right. So we got some good motion there in the neck. We've always done that. As you can see, the back of his shirt here, he is a triathlete, right? That's going to show all levels of cycling, from your general cyclist to your advanced triathlete cyclist and to your crank cycle. So they do go ahead and accommodate for the injured, for the disabled, so that they can also achieve their athletic endeavors. All right, here. Okay, we're going to get some movement in here, Chris. Take a deep breath for me. Completely exhale. Very good. All right.
Good one.
Very good. Relax here for me. Good. Relax right in here for me. Very good. Let me have you lay on your side right here. All right. Again, here we're going to get in here and adjust the lumbar spine, top leg bent, bottom leg straight. Very good. We're gonna adjust the lumbar spine, get some motion in there, keep it nice and mobile. Okay. Take a deep breath for me. Completely exhale. Good. Turn facing the opposite way for me. All right, very good right here. All right. Take a deep breath. Completely exhale. Very good. Let me have you lay face up for me. And we're gonna adjust feet bilaterally. All right. Now he has had some ligament damage on his left foot, and we have. He also is using some inserts that have really helped him. Breathe in, all the way out. Relax here. Very good. Okay, other side. Same thing here. Breathe in, all the way out. Relax here. Very good. All right, we're good. Thank you very much.